Welcome back, everyone. Einstein's Eyes. I'm Carl Rosen. This is my colleague and friend, Jon Ditkoff. We were co-residents at Albert Einstein in New York many moons ago. I'm an oculoplastic surgeon in Anchorage, Alaska, and John's cornea anterior segment in New Jersey. And we're going to make another video. This is a subset on how to treat dry eye. It's going to be on punctal plugs. John places punctal plugs. I don't. I actually, in very rare cases, remove them as an oculoplastic surgeon. When someone has a canaliculitis, we'll get to that. But John, go ahead and describe your experience with punctal plugs, why you use them, who you use them for and on, and that type of thing.
Yeah, so the best way I would explain it is the way I explain it to my typical patient coming in with dry eye. So they're putting eye drops in their eyes to lubricate their eye. And they're putting them in twice a day, 4 times a day, 5 times a day. And what many of them will complain about is when they first put the drop in, it doesn't last that long. And the problem is, if you know the normal physiology, which Carl could explain to us, you put the drop in and it goes in the eye and then it goes right out your tear duct. So there's 2 little holes, one right here in the lower lid and one in the upper lid. And when you put a drop in your eye, or the lacrimal gland produces tears, which is over here. So imagine your lacrimal gland produces tears, they go in the eye, they circulate around, and then they leave through these little holes. And then they go down into your area here, nasal, and then they leave. So basically, it's almost like a sink. Imagine your sink. This is the faucet. That's the drain. Now, if you were to take a bucket of water and throw it in your sink, you would watch it go right down the drain. And that's the frustration for many of my dry eye patients. They're putting drops in constantly, and they'll say they don't last that long because basically the drop's going in and going right down the drain. So plugs are wonderful because what we do is we actually block the drain. So it's like blocking the drain in your sink. And now when you put a drop in your eye, instead of it going right down the drain, it stays in your eye much longer. So there's different options for plugs, different ways to do it. I'll tell you my approach. What I like to do is I put in collagen plugs. Collagen plugs dissolve within a week. And it's a trial. It's like an experiment. I say to my person, hey, how you doing with the tears? I'm a little frustrated. They're not working great. Let's put in these plugs. So I put a plug down here. I put a plug up here. And I say, see it. So that procedure itself takes a couple of minutes to do. It's very safe. And all I'm doing is I'm taking these little tiny plugs and putting them in those little holes. And they dissolve within a week. And then I have the person come back in about 3 weeks and I say, how was that? And for some of them, they didn't notice a difference, but many of my patients, I would say at least 90% of them will come back and say for a few days, maybe 4 or 5 days, they felt better. And then when the plug dissolved, they started to feel worse again. That's a great experiment for me because once I hear that, it not only confirms my diagnosis of dry eye, it confirms the fact that the plugs were beneficial. So at that point, we can go one of 2 ways. I have plugs that I can put in that are still dissolvable, but they dissolve 3 months or 6 months. So depending if it's a short-term type of treatment, I might put those type of plugs in, knowing the person is going to come back. And if they're not doing well, we can put new plugs back in. Or there's other types of plugs called, for example, I use Oasis plugs. Those plugs go into the same area, but they have a little cap. And that cap, actually, if you look very closely with a microscope, it actually is outside the eye. So I can see it. Most of my patients can't see it. But the advantage of that type of plug is it blocks the tear duct completely. It's permanent theoretically because it doesn't dissolve. And if a person does have a problem, which we'll talk about, very easy to remove. So in the rare case where the person might say, I'm having too much moisture, I just take it out. Or in the rare person that we see a little infection brewing underneath the plug, I just take the plug out. So I do like those plugs the best. But in some patients, for a variety of reasons, I use the 3-month or the 6-month plugs.
Right.
So in my experience with plugs, what's great about it is it's essentially very safe. Nothing's 100% safe, but it's extremely safe. It's covered by most insurers. It takes me a few minutes to do. It doesn't hurt. It's done right in the office with my microscope. As I'm examining a person, I can just do it very quickly. And I love the idea that I could do that trial period experiment to see if it really works or not. Because if someone doesn't respond to it, we can go a different direction, like we'll talk about in the other videos.
Right, that's great. So you do it in the office at the slit lamp.
Yeah.
So when I spoke about an oculoplastic procedure where you can remove the plugs. Those are the rare occasions where the plugs get inside
Yep.
we call the canaliculitis, which is the tube that goes from the puncta to the lacrimal sac, which sits right here in this area. It's called the medial canthus before it drains into the nose, the intranasal cavity. So,
Yeah, so I'll tell you, I want to hear what you do to treat it, but my experience with infection, because people are worried about infection always. So with dissolvable plugs, I actually haven't seen many infections, if at all.
yeah,
And the good news about an infection, if it really did occur with a dissolvable plug, worst scenario, I could leave the person on antibiotics for a little while and just wait for the plug to dissolve. So I'm
right.
not really concerned, but I have seen infections with those other plugs I just mentioned. But the good news about that is they don't need to see Carl, because I just take the plug out and the infection goes away. And in fact, a lot of those people, a few weeks later, they're like, my eye's dry, I need my plug. You know, they're running back for me,
Right,
even
right.
though they had an infection, because they know it wasn't a big deal. But there was a plug many years ago. I've been doing this for 28 years. One of the most common plugs I used many years ago was called a smart plug. It was amazing technology. It would go in very small, and once it heated to your body temperature, it would expand. So it was pretty amazing. It blocked the canaliculitis really well. And in fact, it was a great plug for dry eye. And I put in thousands of patients that were really happy. However, I did have at least 10 or 15 infections, and they were more difficult because those plugs were socked into the canaliculitis, like Carl's mentioning. And they could be, I mean, I was fortunate I was able to remove most of them right in the office, but occasionally they did have to go to surgeons like Carl, who had to go into the operating room and explant them. The good news is I don't really use those plugs anymore. So I really don't see this on a regular basis. Now, I don't know, in Anchorage or Alaska, I mean, I don't know what you guys are doing. I'm in Jersey, you know,
Right.
but I think in the whole, it's a really safe, great procedure. But I think, you know, like anything, you want to go to some doctor that's experienced, knows what they're doing, has been doing this for years. I mean, for example, for myself, I put plugs in bottom and top all the time. Many patients come to me, they've been suffering with dry eye for years. They're complaining, and I look at them, I see a plug in the bottom, and I say, how come the doctor never did one on top? Like, well, they never even considered it. So it's a good example, you know, Carl is bringing up where technique is important, what the surgeon uses is important. And I'm not saying I'm the only good guy. There's plenty of great guys out there. You can find someone wherever you live, but I think you want to find someone with experience. And then I think the other thing is, in those rare cases, you want to have, like, I have an oculoplastic guy in my office. If I really need it, I know he can handle taking a plug out if I really need it.
Right. So the take-home message is ask your surgeon or your optometrist or your ophthalmologist, how many have you done? What's your experience? Don't be afraid to do that.
Yeah.
And the canaliculitis that can occur in that rare instance, you get a lot of discharge. You tend to wake up with the eye stuck shut. It's uncomfortable. It's chronic. Then you want to mention that to the ophthalmologist, the optometrist, so you can see an oculoplastic specialist and have
Right.
it. But listen, that was fantastic. Jon, as usual, you hit it out of the park. Great job. So I learned a lot today, and I hope you guys did too out there in YouTube land. We'll see you on the next video. Take care. So long.